name is Mary Mills. I'll be your trainer today, and today we're going to be reviewing sponsor quality management, risk-based risk management requirements, and approaches for compliance related to the final ICH GCP E6R2 guidance. So let me tell you just a teeny bit about me, and I mean a teeny bit. I'm not going to go through every bit of this, but as you can see from the first bullet point, I've been around for a while. I'm a nurse, and I started out in healthcare but quickly entered into the clinical research arena first as a study coordinator. And I've over the last almost 30 years done almost everything except things related to biostats and a lot of data management, things I've not done. But I work primarily on the clinical side. I have done some auditing, and I work very much in the risk-based quality management area and specifically risk-based monitoring. I started out very, very early on before risk-based monitoring came into vogue, working on a very large clinical trial where we employed a risk-based quality management approach with risk-based monitoring. And as you can see here on the slide, it was a super huge trial. And I'm pressing towards doing even a bigger one, hopefully, than this, a whole lot bigger. But we were able to secure marketing approval in many, many countries, and the FDA actually commented on our quality. So a lot of the approaches and things that I'll talk to you about today are strictly from the updated guidance, but I'll also give you a little bit of experience of just some things that I have seen that really work that are parallel to the guidance. So I also train an awful lot. I may know some of you. Actually, a couple of your names sound very familiar as I was looking through, and I'm a member of several professional organizations, and that's enough about me. Let's talk a little bit about what we're going to do today. We've done our welcome. We're going to review our learning objectives, and then we're going to just dive right in to the quality management risk-based approaches for clinical trials. We're going to talk a lot about Section 5 of ICH GCP E6R2 and how that applies in an end-to-end, that's how I affectionately love to refer to it, process for writing your protocols all the way through clinical trial reporting. We'll talk about suggestions for successful implementation, and you will have chances all throughout to chat questions to me, comment to me, and then we'll just do a summary and re-review our learning objectives. Upon completion of this course, you should be able to describe just two, I'm not going to ask you to describe them all, new requirements for the sponsor's quality management of clinical trials to identify two approaches to achieve compliance within your organizations with quality management for the clinical trial life cycle. That's that end-to-end process that I'm talking about. And think and determine some next steps for evaluation and implementation of the new requirements. If you would look at the green checks, red X's, smiley faces with sunglasses, and if you would put by your name, if you have already started implementing, if you would use a smiley face with sunglasses, by your name, and that would include the group that's with you. If you've already started implementing and doing your gap analysis and started implementing the addendum, that would be wonderful. Somebody gave me another emoji. I'm trying to find it now. It went away. Somebody gave me a smiley face with an open mouth, and maybe they changed it. Okay, so it looks like maybe about half of you don't count on my science here, but I just wanted to kind of see where we are. So let's let's talk. We're actually going to go to slide 7, and then we'll come back to 6 because I've got them out of order here. But let's talk for a few minutes about the drivers for the addendum, because they really, really set the stage for what we're going to talk about. So, as you guys know, and I usually ask the question, but I won't today, we had not had a change or any update in ICH GCP E6 since 1996. So here we are 20 plus years later with the first update.